Hi, welcome to Tennis Tonic and One Physiotherapy. My name is Leslie, I'm a sports physiotherapist, and today we're going to be talking about foot injuries. And one of the most common types of foot injuries is called plantar fasciitis. Plantar fasciitis is basically inflammation of the structure called the plantar fascia, and it affects people of all ages and of different sexes and different sizes as well. The foot can be divided into three different categories. So you have flat feet or overpronation, you have the normal arch, and then you have someone that's got a very high arch. And plantar fasciitis can affect all three different types of people. Our model here actually has a very high arch in his foot. And what's really important for as a tennis player or any type of sportsman is to select the right shoe for your foot. So with a high arch, you have to understand that the arch itself is meant to pronate a little bit. So with people with a high arch, they lose that pronation, and that pronation is really important because it actually acts as a shock absorber. So when it comes to selecting the right shoe for people with a high arch such as this, you need a shoe with good shock absorption properties, okay? Which is why some people actually get injuries when they're using old shoes that kind of worn out and they've lost their shock absorption properties. Okay, so for these people with high arch, make sure you have good cushioning, okay, and change your shoes regularly. If you're playing tennis or doing sports 4 or 5 times a week, then you're looking at changing your shoes, at least every 6 months. People with overpronation or flat feet have the opposite problem. So basically with overpronation, the arch collapses too much. So you need a shoe with a very, very good rigid arch support, okay? And you can actually find shoes that are specifically designed for people that have flat feet or overpronate too much. So you need a shoe that has a very, very firm sole and a very, very strong rigid arch. Now some shoes may not actually have this, and you may have to add something inside the shoe, such as an insole or orthotic device to artificially support that arch. With plantar fasciitis, it commonly affects people that play a lot of sports 3, 4, 5 times a week. Another reason to get plantar fasciitis is people that have laid off sports for a while and then they return to their sports very, very quickly. Weight gain is also a factor of plantar fasciitis. And why is that? Because the plantar fascia, think of it as a ligament that helps support the arch. Unfortunately, this ligament can fail, and it usually fails at this point here called the calcaneum. So what commonly people would report is that when they wake up in the morning, with the first step they put on the floor is very painful. Once they start to walk a little bit more, or once they start to exercise a bit, the body warms up, the plantar fascia warms up, and then it gets a bit more elastic. Most commonly, the pain could actually subside or go away, and it will come back again the next day. So it's like a vicious cycle. So plantar fasciitis can affect all different types of feet. So people with high arches, people with low arches, overpronation. However, I must say, it does affect people that do tend to overpronate a little bit more. Hence, getting the right shoe for the foot is incredibly important for everyone, especially people that overpronate. So getting the right shoe for the foot is very, very important. And if you look at someone with a high arch especially, some shoes may not be adequate to support that arch, okay? Or someone with a very low arch, the actual arch in the shoe may not be adequate to support that as well. So getting an insole can sometimes provide instant relief for people with plantar fasciitis, okay? And there are different types of insoles. There are generic ones that you might buy off the shelf for maybe $50, $60, or there's custom-made ones. Sometimes these are quite expensive, especially if you go to a podiatrist or a specialized person that makes insoles. However, there is another insole that you can get called orthotics, and with this you can actually make it yourself and put it inside your shoe, and they're incredibly effective. And with the right insole for the right foot, the pain for plantar fasciitis can actually go away almost immediately, and you should be able to feel the effects straight away. With plantar fasciitis, the most common area of pain is basically just on the inside of the heel here. And what you can do to treat yourself is you can actually do some self-massage. So you might have to sit down or find a bed, and basically all you need to do is just rub right on that painful spot. And it is quite a painful treatment. To treat yourself, you can actually do some self-massage. So all you have to do is just sit down and just put any cream and just do little small rotations here, okay, small little circles. You're trying to break away the scar tissue, okay, you're trying to loosen up that plantar fascia. This is the most common area of pain, is right on the heel itself. And you can just work your way up the foot, okay, and just work into that plantar fascia the entire length of the way. Alright, and you can do this yourself with cream, anything you want. And just small little circles, such as this. The third thing you might like to do is actually use tape. In addition to using the insole, tape can provide an additional support that allows you to keep playing your sport, playing tennis, even with a condition such as this. So I'll just put this insole aside and I'll show you how to actually tape the foot. Now the idea of taping is to support the arch, okay? So what we're going to do is use this tape called Leuko tape or sports tape. Now there's other tapes around in the market. You might see that some sports tape is white in color or different brands. However, what I found is that with Leuko sports tape, it's by far the most effective. It sticks better, it's easier to take off, there's less allergic reactions, and of course when you take off the tape, there's less residue as well. Okay, so Leuko sports tape is by far the best. Now with taping, there's a very handy trick that you might like to try. Before taping, you want to clean the skin. Make sure there's no sweat, no moisturizing cream. Okay, that allows the tape to stick better. The second thing as well is allow about 20 to 30 minutes for the adhesive on the tape to actually form a bond with the skin. Okay, so give yourself 20 to 30 minutes, tape your foot. Don't go out and start playing yet, just wait a while and then you'll find that that tape will actually adhere itself to the skin very, very effectively, so it won't come off. So what we're going to do now is tape the arch. Now I'm going to start off with a long strip of tape, okay, so it's probably longer than the foot itself. And what we're going to do is put the first strip of tape like a horseshoe, okay, so if you imagine a horseshoe, so it just comes up just like that. Alright, so quite simple. Okay, now the next thing I'm going to do is put some tape to actually support the arch, okay, that goes perpendicular to this horseshoe. Okay, now this kind of acts as the anchor, and now we're going to add some strips that will support the arch. So starting on the outside of the foot, we're going to pull onto the inside of the foot. So nice shorter strips. You can see it's shorter than the length of the foot. Now it's up to you how many you want to do. Okay, you can do 4 or 5 of these shorter strips. But the main thing is we're going to overlap each strip. Okay, working our way up the foot, starting on the outside, pulling up to support the arch. Now the closer you get to the heel, which is where most of the pain occurs, okay, the more important it is. So you have to add a very so here's that last strip that pretty much crosses over the area of the pain. Okay, and you can see what this does, it's artificially supporting the arch. So I've done 1 anchor and I've done 4 strips that support the arch. You can do more if you like. And now we're gonna anchor it again. Okay, so it's longer than the foot. We're gonna put that horseshoe anchor again. And the purpose of this is just to hold the tape in. Okay, so it acts as a secondary anchor. Okay, so immediately when you start to put weight on the foot, you notice the tape will actually support the arch. Now using tape in addition to the insole is great. Now some professional athletes actually have this injury and they may carry this injury for the whole season. Unfortunately for them, it's difficult for them to take a break and to rest and to give themselves 2-3 months to heal because they have to participate. So what they might actually do is tape and use the insole at the same time, and they could actually carry this injury for the whole season, and it's very, very common for some of these athletes. With treating the plantar fascia, apart from massaging it yourself, you can actually use a tennis ball or a special trigger ball such as this. So our model here is going to demonstrate how to do some massage with the tennis ball. So placing your foot on top of the ball, all you need to do is just roll your foot slowly up and down, and the whole idea is to put some weight on it, and you might feel a little bit of pain, but that's okay. What you're trying to do is break down that plantar fascia, make it looser. Now most of the pain with plantar fascia is actually on the heel area, just on the inside there. So sometimes you might have to angle your foot, just like that. okay, to get a bit of weight on that area. There is one thing though, try and avoid pressing directly onto the heel itself, okay? Try and avoid pressing directly onto the bone, as you might aggravate it a bit too much. Apart from the tennis ball, however, a more effective strategy is to use a trigger ball like this. Okay, so applying a bit of weight, roll your foot up and down, and you can do small circles if you like. Okay, so alright, good. An additional thing with plantar fasciitis is that tight calf muscles can actually be a factor. And even with treating patients at our clinic, with plantar fasciitis, we actually do work on the calf itself to loosen it up. So a good idea is stretching the calf. Now a basic calf stretch such as this, alright, so our model is going to demonstrate a calf stretch. You might note that the foot is pointing outwards, which is a common mistake. So make sure the foot is pointing straight, both feet pointing straight. The second thing is that this knee itself, okay, this position is slightly bent. Make sure it's locked out nicely. Okay, so you get a good stretch along the whole calf muscle, such as this. Some people actually find that this stretch is not quite good enough. Okay, so they want something a little bit extra, a bit stronger. So the best way to do that is use a ledge or even a tennis ball such as this, and you need to place it underneath the foot. Okay. And so we're going to do a calf stretch now, and it's a very, very strong stretch. Now you don't need a tennis ball, you can just use a ledge or the edge of a step, okay, something like that, and do the stretch. So thank you for checking out our video, and thank you for watching, and I hope these strategies were helpful with you and your plantar fasciitis.